Good morning. Thanks for tuning in to today's reading of the Acadiana Advocate, a public service here on AOC 1, as well as Cypress Street Radio. So you can take us along on your phone or in your car, aocinc.org/CS radio. We've got a lot of news to cover this morning, so let's go ahead and get started. Cases rise across Acadiana, an article by Claire Taylor. The number of confirmed coronavirus cases in Louisiana jumped Thursday by 510, bringing the total to 2,305 in the 2.5 weeks since the first case was reported on March 9th. Governor John Bel Edwards, who this week ordered all non-essential workers in Louisiana to shelter at home to control the spread of COVID-19, in a news conference Thursday afternoon, took on a sterner tone with residents. He warned that if people do not stay home and the virus continues to spread, there won't be enough medical workers or ventilators for all the infected. Excuse me. Of the 676 coronavirus patients in Louisiana hospitals, 239 are on ventilators, the Louisiana Department of Health reported Thursday. Lafayette Parish Mayor President Josh Guillory, in a news conference Thursday, warned residents not to get complacent. "We are still dealing with a virus that is extremely serious," he said, "that has shown it can kill." No deaths from the coronavirus have been reported in Acadiana, but across the state, as of noon Thursday, 83 people succumbed to the virus, including 46 in Orleans Parish. Guillory stressed the importance of exercising common sense and staying home to flatten the curve, referring to a graph displaying the increase in cases unless the spread of the virus is cut short. The purpose of sheltering at home is to slow the spread of the virus so hospitals aren't flooded at once with patients, many of them needing ventilators to breathe, a resource that already is in short supply across the country. In 8 days, the number of confirmed cases of the coronavirus in Lafayette Parish jumped from 2 on March 18th to 30 on Thursday, according to the Department of Health. Elsewhere in Acadiana, Vermilion Parish on Thursday reported its first case of the coronavirus. St. Landry Parish had an additional case, bringing it to 5, while St. Mary Parish remained at 5 cases. Acadia and Iberia parishes added 1 case each, bringing them to 3 total. Evangeline Parish remained at 2, St. Martin Parish is at 2 cases, and Jefferson Davis Parish at 1 case. At the drive-through coronavirus screening and testing site at the Cajun Dome, 70 people were tested for COVID-19 Thursday, while 55 did not qualify for testing, said Jamie Angel, Communications Director with Lafayette Consolidated Government. Since the Cajun Dome site opened March 18th, 1,286 people were screened. Of those, 658 were tested for the virus, and 628 did not qualify, he said. Anyone in Acadiana who believes they have symptoms of the coronavirus should call 311 if they are in Lafayette Parish. Anyone outside Lafayette Parish should call 337-534-TEST to speak with a medical professional who will pre-screen them, possibly sending them to the Cajun Dome, their doctor, urgent care, or the emergency room for medical care. We haven't seen the curve flatten. State moving beds into New Orleans Convention Center to handle looming overflow of patients. An article by Sam Carlin and Jeff Adelson. Louisiana is taking drastic steps to surge its medical capacity to prepare for what officials fear could be an overwhelming tide of coronavirus patients in the coming days, with the state planning to put more than 1,100 beds in the Ernest N. Morial Convention Center to ease the strain on New Orleans area hospitals. The move, which will see 120 beds in the convention center by the end of this weekend, is the linchpin of a plan to boost the number of hospital beds, healthcare workers, ventilators, protective equipment, and other resources available in Louisiana. That plan now includes 60 new health staffers and 2 new 250-bed field hospitals to be provided by the federal government, half of the 1,000 beds Governor John Bel Edwards requested, along with nearly 400 intensive care beds that hospitals across the state are adding in the coming days and weeks. But Edwards on Thursday warned that none of it will be enough if the number of cases doesn't start to wane soon. For the second straight day, Louisiana confirmed a record high number of new cases and saw an alarming spike in deaths as testing continues to expand considerably. Of the 2,305 positive cases, 83 had died, 676 were hospitalized, and 239 were on ventilators, vital machines that are in short supply. Those numbers kept New Orleans on a trajectory to run out of ventilators by the first week in April and to run out of hospital beds for patients by April 8th through the 10th, Edwards said. This isn't conjecture, Edwards said. This isn't some flimsy theory. This isn't a scare tactic. This is what's going to happen. The governor delivered his most forceful message to date to Louisiana's 4.6 million residents, urging them to heed his stay-at-home order and take social distancing seriously. The change in tone was prompted by another staggering rise in cases, Edwards said, and because we haven't seen the curve flatten. The governor's rhetoric surrounding the pandemic has started to diverge from that of the president, who in recent days has said he wants to get the country back open for business. In a letter to governors Thursday, President Donald Trump said the Federal Centers for Disease Control and Prevention was developing new guidelines for social distancing and restrictions and would classify counties as high, medium, or low risk. Edwards said he would review the guidelines, but until the number of positive cases stops climbing at a steep rate, causing the curve to level out more, we are not going to do anything that is less restrictive. The governor also said he requested 5,000 ventilators from the federal stockpile, but the state has received 0. Meanwhile, he got 92 of a 100 ventilator request to private vendors and hopes to land another 100 in the coming days. Those numbers are not the kind of numbers that we need, he said. We need several thousand ventilators. The move into the convention center, a mammoth structure spanning a full kilometer near the New Orleans riverfront, represents the most significant effort to date by officials to boost the state's medical capacity. With more than 3 million square feet of halls and meeting rooms, the building is more than twice the size of all the healthcare facilities at New Orleans University Medical Center. The exhibition halls alone have enough room for nearly 5,000 booths. In each of those spots was converted to a space for a patient. The convention center's capacity would be more than 10 times that at UMC. Even as Louisiana gets more beds, though, officials need to find workers to staff them. The staffing issue is becoming so acute that the governor's administration set up a website to solicit volunteers, such as retired doctors and nurses, to be dispatched to the front lines. Some medical schools across the state are likewise trying to get newly matched residents to hospitals immediately instead of waiting several months until they would normally start. All of that together isn't enough if we don't get off of this curve, Edwards said. We can move more on these wings, 120-bed wings, into the convention center, and we will if we have to, but staffing those beds becomes very, very problematic. By converting the convention center to a field hospital, Louisiana is following in the footsteps of New York, facing predictions that New York could need up to 110,000 beds as the virus spreads, more than twice the current capacity of its hospitals. The Federal Emergency Management Agency began converting the Javits Convention Center in New York City to a 2,000-bed hospital over the weekend. The state will use a similar set of plans developed by the U.S. Army Corps of Engineers to convert the convention center in New Orleans, said Commissioner of Administration Jay Darden. Darden said the state hoped to sign a contract late Thursday or Friday with Dynamic Construction Group, LLC, a Baton Rouge construction firm, to build out the facility with pod-like structures to house individual patients. Another contract will staff the facility with medical workers, though it was not clear Thursday how much the state would spend on the deals. New York and Louisiana have been linked throughout the coronavirus crisis as two of the hot spots for infections in the United States. Though Louisiana identified its first case 8 days later than the Empire State, Louisiana has been identifying new infections more quickly and now has more than 5 times as many confirmed cases as New York did this far into its crisis. Turning to the convention center as a sanctuary during a disaster may open old wounds for New Orleanians who remember the chaotic scene as tens of thousands of their neighbors turned it into a makeshift shelter after the levees breached during Hurricane Katrina in 2005. The convention center became a beacon for those seeking to escape their flooded homes and neighborhoods, but because it was not an official shelter like the Superdome, there was practically no food and little authority on the ground. Days later, as false rumors swirled of violence around the site, Lieutenant General Russell Honore, after issuing his now famous instructions to National Guard troops to keep their weapons lowered, arrived at the site to cheers and quickly began setting up food distribution and other resources. A field hospital would eventually be set up in the convention center to make up for the trauma centers throughout the city that flooded and closed. Honore said Thursday the sprawling complex provided a near-perfect solution in the current crisis because it is large, clean, and centralized and has food service and other equipment. We're going to need places to put people who have been identified as infected to isolate them, and you can isolate their ass in them rooms, Honore said in typically blunt fashion. The convention center has been discussed as a potential shelter during other hurricanes that have threatened New Orleans, but Honore said those discussions never went anywhere because of opposition from its board, a quasi-independent body. In the current crisis, he said he believes the governor likely had to forge ahead over the board's opposition. There's an attitude with this convention center board that we will not use the convention center to save our own people, and they can go to hell, Honore said. On a lighter note, virtual concerts to replace Downtown Alive, remote events to help musicians who lost gigs amid the pandemic. Beginning Friday, which is today, Acadiana music lovers can enjoy a series of virtual concerts on Friday nights. Called DTA House Sessions, the concerts are aimed at filling the gap left behind when the spring Downtown Alive concert series was canceled because of the coronavirus pandemic, according to a statement from Downtown Lafayette Unlimited, which organizes the concerts. The house sessions will help to raise money for Downtown Alive musicians and others who have lost income because of canceled gigs. Downtown Alive is a cultural institution in the Lafayette and Acadiana community, said Anita Begno, CEO of Downtown Lafayette Unlimited and the Downtown Development Authority. We were bummed to cancel the spring season of DTA, but our nonprofit organization has pivoted to providing support for downtown businesses and musicians who are suffering during these unprecedented times, providing an outlet for the community to come together using social media to support our local musicians and enjoy some incredible music. It's the least we can do right now to help keep the community united. The first virtual concert will feature a live performance by Lane Mack at 7 p.m. this evening. The performance will be broadcast live via the Downtown Alive Facebook page and shared on the Downtown Lafayette website and social media channels following the live stream. Also, we will be carrying it here on AOC1. You can also stream at aocinc.org/watch. Audience members will be encouraged to leave tips for Lane Mack and the Balladeers, purchase DTA merchandise, of which a portion of sales will go to local musicians, or donate to a Lost My Gig fundraiser. Helping Hands. Brewer makes and donates hand sanitizer, an article by Megan Wyatt. Last week was anything but easy for the people behind Bayou Teche Brewing in the wake of statewide restrictions to slow the spread of the novel coronavirus. Carlos and Stephanie Knott had to temporarily lay off 7 people as they closed their Arnaville tap room and significantly reduced production of their craft brews. With the closure of restaurant dining rooms and bars, they would only be brewing and bottling for grocers and other retailers in the coming weeks. Instead of dwelling on the impact that COVID-19 would have on their business, the Knots focused on how they might be able to help their community. They heard about the critical shortage of hand sanitizer and learned the federal agency that oversees breweries was providing expedited authorization for brewers and distillers to make the high alcohol product to help meet the demand. The Knots applied for the necessary permit on Saturday through the Alcohol and Tobacco Tax and Trade Bureau, and they were cleared Sunday to start. They began purchasing ingredients and supplies, which are in high demand across the globe. By Thursday, they were bottling dozens of gallons of hand sanitizer. "We're just trying to make it available to our town," Stephanie Knott said. "We're just making as much as we can and providing it to a nonprofit to distribute it." The Knotts are aiming to make about 700 gallons of hand sanitizer in the coming days for nursing homes, medical facilities, jails, and other places where people are most at risk of getting and spreading the virus. Le Bon Voisin, an Arnaville nonprofit whose name translates to the Good Neighbor, is helping to fund and distribute the hand sanitizer. "This thing has blown up," said Courtney Petrie, an Arnaville pharmacist and founder of the nonprofit. "We knew there was a need to be met, but we didn't realize just how much of a need there is. It's kind of amazing and also scary how much of a need there really is. I'm hearing from people in healthcare who can't get hand sanitizer. I knew it was bad. I didn't know it was that bad." Carlos Knott, who serves as president of the Louisiana Craft Brewers Guild, has been reaching out to brewers and distillers across the state to source alcohol and encourage others to consider making hand sanitizer. Although breweries do not make alcohol used in hand sanitizer, they typically have the measuring equipment and most permits necessary to quickly produce the germ-killing alternative to soap and water. The Knotts have been purchasing ethanol from small Acadiana distilleries, including Wildcat Brothers in Lafayette and J.T. Mellick in Branch. "It's all about adaptability and survival," said David Moe, distiller and founder of Wildcat Brothers. "People aren't buying rum right now, but there's a huge need for alcohol." The Knotts are following the World Health Organization's formula for hand sanitizer production. "It's been a learning experience, but it's also been a rewarding one. The whole country is doing this kind of thing," Stephanie Knott said. "I think most of us are doing whatever we can to help others." In other good news, dealerships launch efforts to aid seniors by Ken Stickney. Sales are slow, so employees at Giles Automotive in Acadiana are using their time for social good, Ryan LeBlanc, company president, said on Thursday. LeBlanc said the company decided this week to commit its 180 employees at 4 Louisiana locations to serving the region's elderly population, many of whom are housebound because of the coronavirus threat. Those 60 and older are most at risk from the virus, which is now in the pandemic stage. The effort is called the Essential Errand Running Service for Seniors, and it's intended to help seniors in the Lafayette and Opelousas areas. "We are getting a ton of calls right now," LeBlanc said of the volunteer effort. "It's really picking up steam. We've been taking calls all day." Employees are volunteering to help with tasks like picking up prescriptions and groceries for older people. Giles operates 3 dealers on Johnston Street in Lafayette, including Nissan Lafayette, Subaru Lafayette, and Volvo Lafayette, as well as Nissan Opelousas. The company also has a dealership in Texas. LeBlanc said the volunteer effort grew from a discussion he had with Stephen Benitez, a personal development operation manager. He said the company didn't want to lay off employees despite slow sales caused by sheltering-in-place mandates from Governor John Bel Edwards. The two decided to help seniors in that they were most imperiled by the coronavirus among age groups. The stay-at-home order came out Sunday, so we were scrambling, LeBlanc said. By midweek, the company had some organization for their volunteer effort, and he said the first grocery pickup was due Thursday. LeBlanc said his employees are also picking up vehicles from seniors' homes and taking them for service to any area dealership, not just their own. Word got out through advertising and on social media, he said. By noon Thursday, the website had some 500 or 600 shares. He said, for example, employees will pick up groceries at participating stores and take them to the senior citizen's home, leaving them a safe distance from the door to meet social distancing recommendations. We just do not want senior citizens to go out. We want them to have the least amount of contact possible, he said. The coronavirus is usually spread from person to person, and health experts recommend that people stay at least 6 feet apart from other people in public. Giles has a long record of community service in Acadiana. It has participated in such programs as Dreams Come True, which serves children with serious illnesses. It has purchased bulletproof vests for the Opelousas Police Department when budgets were low, and it helped generate money for St. Landry Parish churches that were burned by suspected arson. The service will continue weekdays 8:30 a.m. to 6 p.m. through Easter, longer if needed. Call 337-210-9015 for help. They are the most vulnerable, and many are in desperate need for a helping hand. Bob Giles, chairman and CEO of Giles Automotive, said, "We are here to help." And toilet paper production is rolling along at a Louisiana plant. An article by Kristen Mossbrucker. Don't blame manufacturers for that empty toilet paper shelf at the grocery store. Plants like Georgia Pacific, just north of Baton Rouge, are running at full tilt, even finding ways to churn out more of what's becoming a hot commodity in a stay-at-home world. People are requesting twice as much. We are making as much as we can, said Patty Pratt's spokeswoman at Georgia Pacific's Port Hudson plant near Zachary. The toilet paper and paper towel plant is working around the clock to meet customer demand as shoppers have cleared store shelves amid the coronavirus pandemic, she said. The plant is at 120% of its normal capacity for toilet paper. It always operates around the clock, so its 350 workers can't put in longer shifts to increase production. Rather, the company has maximized the number of deliveries it can send out of the facility to exceed its normal output. The plant doesn't disclose production numbers of the Angel Soft and Quilted Northern brands made there, but the mill is able to produce 40,000 rolls of toilet paper each hour. So in a 24-hour day, it could produce 960,000 toilet paper rolls or 160,000 packs of 6. As Americans were ordered to stay home and bathroom visits shifted away from work and school, the demand for toilet paper skyrocketed as people stocked their homes. Toilet paper sales across the nation jumped about 213% during the week ending March 14th, compared with the same time frame last year, according to market research firm Nielsen. Georgia Pacific estimates the average U.S. household of 2.6 people uses 409 regular toilet paper rolls each year, based on information from market research company IRI and the U.S. Census Bureau. The company estimated that staying home would increase usage by 140%. The company encourages consumers to buy only what they need and not to build stockpiles that put a strain on supplies. The Port Hudson facility is among 11 factories across the U.S. manufacturing toilet paper, all of which are 24-hour operations and employ 7,500 people. The local mill is part of a national supply chain under contract with retail customers. Because most of the toilet paper sold across the country is manufactured in North America, that makes restocking easier for retailers compared with other products made overseas that are facing delays. Only essential personnel are physically working at the Port Hudson mill. The company also has enforced social distancing policies and is minimizing contact among workers. A statewide stay-at-home order has shut down non-essential businesses, but manufacturers are exempt from the order. Employees at Georgia Pacific are deemed essential, but those who can are working remotely from home, the company said. This is really part of our effort to protect employees operating the facility and to do everything we can to prevent the introduction of the virus into the facility, the company said. Some concerns at the mill include a potential disruption in the supply chain and ensuring workers who feel sick stay home. We can't produce if we don't get the pulp, Pratt said. Right now, everything is flowing, but we just don't know when things will change. We are trying to operate as normally as we can. Georgia Pacific receives pulp from mills, from other company-owned locations, and external suppliers. The company has already cross-trained workers on machines as one way to avoid a business disruption. The Port Hudson plant hasn't needed to hire more workers or rehire any of those laid off last year when it shut down a separate office paper production division that included its pulp mill and wood yard. While there are a few job availabilities posted, the facility is currently not actively looking to hire employees at the moment, but that could change at any time, the company said. Georgia Pacific posted jobs for an automation technician, senior financial analyst, and manager of analysis for consumer products in recent weeks at the Zachary facility. And a waiter once again tries grocery delivery in Lafayette and Baton Rouge, an article by Megan Wyatt. Waiter, the popular restaurant delivery company based in Lafayette, is again testing out same-day grocery delivery in South Louisiana as the coronavirus shutdown increases demand for the service. The company is delivering grocery essentials from Champagne's Market in Lafayette and Ralph's Market in Baton Rouge. Waiter tested out grocery delivery services in 2017 through Market Basket locations in Lake Charles and East Texas. By the time Waiter introduced grocery delivery in 2018 at Champagne's Market in Lafayette, other services such as Shipt and Instacart already dominated the market. Demand has increased sharply in recent weeks for grocery delivery in South Louisiana as leaders have closed schools and some businesses, telling people to stay home to slow the spread of the novel coronavirus. Like restaurant orders, Waiter is offering no-contact delivery for groceries to ensure social distancing between delivery drivers and customers. Customers can place orders for grocery items from a store in the same way they order dishes from a restaurant through the Waiter app or website. In such a time of need, we felt like it is our duty to utilize our platform in any way possible to support the community and plan to support more communities like this in the very near future. Carl Grimstad, CEO of Waiter, said in a prepared statement, "We want to be a valuable resource for our local communities during these tough times. Like I've said before, if there is anything we can do to ensure the safety, health, and well-being of our partners, employees, and community, we will do it." In state news, Orland's death rate highest in the U.S. by far, an article by Gordon Russell. Orleans Parish has the highest per capita death rate for the coronavirus among all American counties to date, a new analysis by the Times-Picayune, the New Orleans Advocate, shows. More disturbingly, perhaps, it's not even a close call. The county with the number 2 rate, Richmond County, New York, better known as Staten Island, has a rate half that of New Orleans. Jefferson Parish, meanwhile, had the 6th highest per capita death rate among American counties. By Thursday, 46 New Orleanians had died from the virus, or a little more than 1 out of every 10,000 city residents. In Jefferson Parish, which has recorded 12 deaths, the rate was about 1 for every 36,000 residents. Viewed another way, New Orleans has recorded more deaths than Manhattan, generally seen as America's epicenter of the pandemic, with a population less than a quarter as large. The advocacy organization Together Louisiana has been sounding the alarm about New Orleans death rates for several days. Epidemiologists and other experts called the numbers worrisome, but said it was too early to understand precisely what they prove. They offered several theories, none of them particularly encouraging. One possibility: the virus has been around longer and thus spread much more widely within the city and its environs than was initially understood. There's a growing consensus that the virus was on the move by Mardi Gras, which landed on February 25th, though the city would not record its first case until 13 days later. Death lags known infections as an indicator of the coronavirus's spread, so a surprising number of deaths here could simply indicate an earlier arrival and a broader spread. However, experts also noted the first death attributed to COVID-19 did not occur until March 14th. That doesn't undercut the idea that the virus was present by Mardi Gras, but it doesn't necessarily suggest it was here for long before then, though it's also possible that some pre-March 14 deaths that were attributed to COVID-19 were simply tallied as deaths from pneumonia. I think we have a huge number of undiagnosed people, said Suzanne Strafe-Bourgeois, a professor at the LSU Health Sciences Center School of Public Health and an expert on pandemics. Our model shows it started around Mardi Gras and spread, and we only tested people sick enough to be hospitalized, which means most people were not diagnosed because they might have mild signs and symptoms or be asymptomatic and be contributing to the transmission. One factor that is almost certainly a contributor: New Orleanians, on balance, are less healthy than other Americans, with high rates of diabetes, hypertension, obesity, and other health conditions that can make one more apt to die from the coronavirus. The data center on Thursday published a report comparing the rates at which New Orleanians suffer from some of these conditions to people in some of the other communities hardest hit by the coronavirus so far. Some of the differences are stark. For instance, 13% of New Orleanians are diabetic, compared with 6% of those in King County, Washington, which includes Seattle, and which was the nation's first hotspot for the virus. Likewise, 39% of New Orleanians have high blood pressure, compared with 28% of New Yorkers. The disease is much more likely to be lethal when it infects those with underlying health conditions or the elderly. The deaths are something that may be a potential kind of bellwether for the underlying health of our health system, said Susan Hassig, an epidemiologist at Tulane University who studies infectious diseases and public health. Diabetes, hypertension, immunosuppression, we've got a lot of these conditions in our community. In interviews, several observers have pointed out that the number of deaths recorded in American communities so far, although extremely worrisome, was small enough to be affected by statistical anomalies, such as the grim toll the coronavirus has already exacted at Lambeth House, the senior living complex in Uptown. There, 12 people have died so far, and more are infected. The complex accounts for about 1/4 of the deaths in New Orleans. Other communities, of course, also have senior complexes, and some of them have had similar and even more alarming clusters. The 35 deaths recorded at the Life Care Center, a nursing home in Kirkland, Washington, account for more than 1/3 of the deaths to date in King County. Even so, if none of the deaths at Lambeth House had happened, New Orleans would still have the highest per capita death rate of any county by a wide margin. There's a mix of opinions about whether looking at deaths from the coronavirus on a per capita basis is a useful way to view them. Many epidemiologists prefer to compare deaths to known cases of the virus, for instance. Orland Parish ranks second among all counties on that measure, behind King County, which has had 100 deaths out of just 1,359 known cases. But the problem with comparing deaths to known cases is that the number of known cases is extremely variable depending on the robustness of a given community's coronavirus testing. Clearly, the testing is an issue, said Mark Lipsitch, an epidemiologist at Harvard University and director of the Center for Communicable Disease Dynamics. Using deaths per capita helps avoid that issue and focus on the size of the epidemic rather than the testing. The clearest example of this is Westchester County, New York, which has the nation's highest known infection rate. With almost 5,000 known cases, about 0.5% of Westchester residents have been diagnosed with the virus, yet only one person in that community has died so far. While some view deaths as the clearest metric, other experts noted that even that hard and fast statistic could be subject to a bit of interpretation. The question isn't whether a patient died, but rather if the coronavirus was the thing that killed them. In Louisiana, every case counted as a coronavirus death requires a positive test for the virus, state health officials said, but the coronavirus doesn't have to be the proven cause of death. Disasters often prompt debates about which deaths should be attributed to the catastrophe, as New Orleanians well know. The list of lives lost to Hurricane Katrina generally includes those killed by the storm's winds and waters, but not the stressors it created, which were blamed for dozens, if not hundreds, of deaths. The same was true of Hurricane Maria, which decimated Puerto Rico in 2017, and whose death toll has been the subject of furious debate. We should consider that maybe the testing of fatal cases has been more effective there in Louisiana than in other places, Lipsitch said. I think a lot of deaths attributable to the coronavirus have been undetected. LSU researchers and hospital leaders create a test lab, an article by Andrea Gallo. Potential coronavirus patients across Louisiana keep encountering the same problem. They visit a hospital, receive a coronavirus test, and then they wait, sometimes for several days, until their results come back. The delays have been frustrating for both patients and hospital staff as they burn through already limited masks, gowns, and other protective equipment they may not have needed to use if a patient's coronavirus results come back negative. But new lab testing capacity at LSU could give coronavirus test results to the Baton Rouge area's most critical patients and providers within 24 hours, as LSU researchers and hospital leaders from around the region have recently created, received federal approval, and started running tests at a newly minted River Road testing lab at LSU's School of Veterinary Medicine. Long before most people recognized the threat the coronavirus would pose to Louisiana, 2 LSU researchers were far ahead of the curve, according to doctors and hospital leaders who have worked with them on coronavirus testing. Stefania Cormier, a respiratory immunology and toxicology expert, and Rebecca Christopherson, an infectious disease and emerging viruses expert, had the foresight to plan for how seriously the virus could affect Louisiana. And when LSU Health Sciences Center professor Dr. Hollis Bud O'Neill Jr. was trying to figure out how to alleviate the bottleneck of coronavirus tests waiting for labs to run them, he reached out to the vet school virologists, hoping they might be able to help provide much-needed viral transport medium, the material used to transport samples to the lab. O'Neill, Our Lady of the Lake Regional Medical Center's medical director of research and a pulmonary provider for Baton Rouge General Medical Center, got more than he bargained for. Cormier and Christopherson not only could provide the media, but also had the capability to run PCR testing for the coronavirus in their labs. They worked with O'Neill and other hospital officials on a plan to meet the regulatory hurdles, which included bringing on Dr. Beverly Ogden, a pathologist with Pathology Group of Louisiana, as the new lab's medical director. We are homebrewed, happen to be the right people in the right place talking to each other, Ogden said. It's not a production line. It's a small group of people making it work. Over the weekend, just 5 days ago, the LSU professors and a team of graduate students were working around the clock trying to prove to federal regulators that they had the ability to run rapid testing for coronavirus samples. They received their federal license Monday thanks to a fast-tracking process. By Thursday, the lab was running tests for under 100 patients a day, O'Neill said. As the lab ramps up, it should be able to run twice that many, 2 runs a day for 95 or so patients each. Our goal was never to be a massive testing center, O'Neill said. Our goal was to decompress the hospitals in the Baton Rouge area as much as we can to move patients in and out. Our Lady of the Lake, Baton Rouge General, Women's Hospital, and other area hospitals are now sending the samples that need the quickest turnaround to the LSU lab. O'Neill also said they hope to make use of the lab's rapid turnaround time for testing of outbreaks at nursing homes, where state officials have identified 6 separate clusters, and they want to use the lab for testing of potential coronavirus samples from first responders, whose results are especially important. Edgardo Tenrero, Baton Rouge General's CEO, said his hospital has been getting results back from the LSU lab in 6 to 12 hours, rather than the 5 to 10 days from state and commercial labs. Tenrero also signed off on the purchase order for a second machine for the lab to do PCR testing, in case the current machine breaks down or in case they need to increase test volume. Obviously, the machine is not built to be a high production machine, so we're concerned we have to have redundancy in that process, Tenrero said. Baton Rouge General fronted $66,000 for the second machine, which he said they will figure out how to pay for on the back end. It should arrive by the end of March. The LSU researchers demurred from accepting too much credit in a statement that says Baton Rouge Clinic, Baton Rouge General, Our Lady of the Lake, and Women's Hospital were their partners in collecting lab samples. Together, we are easing the burden on the other labs throughout the state, said Ginger Gutner, the vet school's communications manager, who added that Cormier and Christofferson were putting their sole concentration on the work right now. The Baton Rouge Health District is also supporting the effort and is donating $30,000 to the LSU Foundation to cover some of Cormier's upfront costs for testing materials, said John Spain, Executive Vice President of the Baton Rouge Area Foundation. Our Lady of the Lake CEO Scott Wester made the first public mention of the new lab testing site Thursday during a conference call when he referred to it as a remarkable feat. Hospitals across Louisiana are increasingly turned toward new avenues for testing as coronavirus cases keep growing statewide. The state lab is under tremendous pressure. They're working 24/7. They're also doing phenomenal work, Tenrero said. I just hope this lab we stood up is, in a small way, helping to alleviate their pressure. Ochsner Health System executives announced Wednesday they had added in-house testing in New Orleans and Shreveport. That addition gave Ochsner the ability to ramp up testing from about 400 per day to 700 per day, and officials expect to be able to run about 1,000 tests per day by next week, also with rapid turnaround rates. O'Neill said the creation of the River Road Testing Lab showed that LSU's virologists are world-class. He said all too often, Louisiana's lack of investment in higher education causes the state to lose its best researchers like Cormier and Christofferson. This is why we need to support higher education in Louisiana, he said. You don't think about it much, but in a crisis, this is who you need. Loan forgiveness, a shot in the arm for businesses. Stimulus provision aimed at retaining and rehiring workers. An article by Tyler Bridges. The federal government will cover the operating costs of businesses in Louisiana for 8 weeks through forgivable loans if they retain or rehire laid-off workers under the $2.2 trillion stimulus package passed by the Senate on Wednesday, which the House is poised to approve today. The provision to forgive loans appears likely to provide a crucial lifeline in the coming days as the nation copes with the unprecedented ravages caused by the coronavirus to the world economy. That will help businesses hold on through this crisis and bring their workers back. U.S. Representative Steve Scalise, the number 2 ranking Republican in the House, said in an interview Thursday from his Jefferson Parish home, where he is self-quarantined because of possible exposure to the coronavirus. Scalise said President Donald Trump will sign the stimulus bill immediately. The U.S. Labor Department released an astonishing set of numbers on Thursday that showed the huge need for the bill. 3.3 million people filed for unemployment insurance last week. That was easily the highest number in 50 years of data, dwarfing the highest previous weekly figure, 695,000, recorded in the depths of the 1982 recession. In Louisiana, about 10,000 people are filing unemployment claims every day now by phone or online, although the number surged to 14,597 Wednesday, the Louisiana Workforce Commission reported. The normal average is 300 per day. The federal legislation also will mean a one-time payment of up to $1,200 to most adults, $500 per child, and provide an additional $600 per week to unemployed workers who remain jobless through June 30th. Businesses and banks throughout Louisiana were scrambling Thursday to understand exactly how the loan provisions would work. In general terms, companies and nonprofits with up to 500 employees could borrow up to $10 million from their bank to cover payroll, mortgage, rent, insurance, and other expenses. The federal government would essentially forgive the loan for business expenses for 8 weeks, said Guy Williams, president and CEO of Gulf Coast Bank and Trust Company, making it essentially a grant. You'd be foolish not to be interested, Williams said, adding that the borrowers would pay 4% interest on money they borrow for spending after the 8 weeks have elapsed, but would pay no borrowing fees on the loan. Companies have to maintain their pre-coronavirus hiring levels for the loan to be entirely forgiven. Camille Conaway, a policy analyst with the Louisiana Association of Business and Industry, said 100 business leaders jumped on a conference call Thursday with the state's congressional delegation, and the main topic was the forgivable loan provision, known as the Paycheck Protection Program. Speed is everything right now, said Conaway. We have members telling us they're taking it day by day to see if they can stay open. We're encouraging each business to talk to their banker to see if this makes sense for them. Jade Melville, president and CEO of Business First Bank, said he has been receiving a steady stream of calls about the program. We'll try to get it onto the street prudently and quickly, he said. Bill Hammock, who with Chef Donald Link owns several notable New Orleans restaurants, said he was already in contact with his bank to initiate a loan. Hammock said he has had to lay off nearly 400 workers while retaining 100. If the government is going to give us the opportunity to keep people employed, we're definitely going to take advantage of that, Hammock said. I'm hoping that it will allow us to hire at least some of them back. David Balhoff, who co-owns 3 orthodontist offices in the Baton Rouge area, is also planning to apply. Balhoff said he and partner Stephen Sherman have been shut down for a month but are still paying all of their 25 employees. We're going to use the loans to pay staff and to pay mortgage and rent on our buildings, Balhoff said. The goal is to maintain a viable business with our staff. Said Tim Scanduro, who operates the Scanduro and Larison law firm in New Orleans, it allows us to be comfortable and confident to keep our employees on the payroll, even though they're not at the office working. Andy Copeland, president and CEO of the Greater New Orleans Foundation, said the loan forgiveness will be a shot in the arm for foundations throughout Louisiana. Nonprofits are feeling very fragile in terms of their ability to stay open, Copeland said. They're making the same kinds of decisions as small businesses in terms of laying off employees and maintaining that payroll. Michael Hecht, president and CEO of Greater New Orleans, Inc., said the program will likely provide major advantages over typical disaster relief programs, which involve loans from the Federal Small Business Administration. The loans are being made by the private banking system, Hecht said. It's quicker than relying on the existing SBA infrastructure, which is not built for a program of this scale. Adam Knapp, president and CEO of the Baton Rouge Area Chamber, agreed. The SBA might have taken 20 days in an optimal time frame, but the banks could be putting capital in companies' accounts in 5 to 10 days, Knapp said. The bottleneck problem gets solved by that provision. Two prison staffers test positive for virus. Angola maintenance man among the infected. An article by Matt Sledge. 2 state prison system employees have tested positive for the novel coronavirus, officials confirmed Thursday, and sources said one of them is a staffer for the massive Louisiana State Penitentiary at Angola. The positive tests highlight concerns about the spread of the coronavirus behind bars in Louisiana, which has the highest incarceration rate in the world and has experienced one of the most rapid spreads of COVID-19 in the United States thus far. The infected worker at Angola, a maintenance man, has been home for days since testing positive, according to sources with knowledge of the situation. Inmates and others who had contact with him have been placed under quarantine. None has tested positive for the virus, although some test results are still pending. No state inmates have tested positive thus far, and 32 inmates have tested negative, according to Ken Pastoric, a spokesman for the State Department of Public Safety and Corrections. He didn't say how many inmates had tests outstanding. Pastoric declined to say whether either state prison staffer with the coronavirus was employed, citing health privacy laws and security concerns. Both employees were notified of positive COVID-19 results over the weekend and are at home in self-isolation at this time, Pastoric said. These employees had limited contact with other staff and inmates. Inmates who may have been exposed have been quarantined and are asymptomatic with no fever. Employees who had contact with the infected staff were sent home to self-quarantine. Wardens across the state have cut off visitation, instituted screening procedures, and counseled inmates on the need for frequent hand washing to prevent the spread of the virus. But the highly contagious virus has nonetheless managed to find its way inside correctional facilities. One inmate at the Jefferson Parish Correctional Center in Gretna has tested positive, and more are awaiting test results there and in New Orleans. 2 inmates at the Federal Correctional Complex in Oakdale and Allen Parish are in isolation after testing positive for COVID-19, according to the U.S. Bureau of Prisons. The novel coronavirus poses a threat to inmates and guards alike within the close confines of prisons and jails, medical experts say. Even if an outbreak of the virus were confined solely to employees, it would still pose a challenge for the state prison system, which has for years struggled to maintain adequate staffing. On March 16th, a coalition of nonprofit groups called on Governor John Bel Edwards to prepare prisons for the coronavirus by taking a variety of steps, including the release of older and medically fragile inmates. We're running out of time here. Let's see if there's anything that's absolutely necessary we want to make sure that we cover here this morning. We've gotten through most of everything. We will skip the horoscopes today. There is one funeral today in the Acadiana area. It's a private memorial service for Shirley East at Calvary Pentecostal Church of Jeanerette at 2 p.m. this afternoon. Before we wrap up, I want to just let you know about a few things going on. Of course, Downtown Alive is doing house sessions starting tonight. You may have heard the article earlier in the newscast. We're going to be carrying that as well. We're going to be taking the live feed from Facebook. So if you're not going to be able to have Facebook, or you have family that may want to watch it on TV, we're going to carry it right here on AOC 1, which is Cox 15, LUS 3, as well as streaming at AOCinc.org. That's this evening at 7 o'clock with Lane Mack. We've got lots of really interesting stuff that we've been putting together to try to help people still be able to continue to share content and share with each other and with us during this period. You can check out our blog there at AOCinc.org. There are a few live stream videos that we've done to show you how to podcast from home, how to submit content to us here at AOC from anywhere. We would love to be able to share what you got going on, what you guys are doing in your neighborhood. We've heard some really fun stories about teddy bear safaris and rainbows on the sidewalks. So be sure and show us what your neighborhood is. It doesn't have to be a TV show. It doesn't have to be a full podcast. It can just be a few minutes of how you guys are getting together and getting along here during the social distancing here in Acadiana. It's a way to kind of, let the community know how we're all doing. So submit some content to us. It's super easy. Go to aocinc.org/submit. That's about all the time we have this morning. We do this weekdays normally with the help of our generous volunteers, but staff members are helping provide this community service during this time. We'll be back here Monday again at 9 o'clock with articles from the Acadiana Advocate. Have a wonderful weekend. Stay safe, everybody. We'll see you back here on Monday.